I am here tonight to tell you that when the UNC wins, healthcare will win. When the UNC wins, patients will win. When the UNC wins, doctors, nurses, and all other healthcare workers will win.
Well, now that the UNC has won, it remains to be seen what this winning would look like. Hi everyone, I'm Howard Spencer of Spencer's Whole Food Plant-Based Eats and Treats, where we believe that the path to good health is by changing your environment, especially your food environment, for the better. Well, the 2025 general election of Trinidad and Tobago has come and has gone, and there is a new sheriff in town. Well, actually, there is a new party in office.
Now that the UNC has won, everybody wins.
The people have spoken, and the people have chosen the United National Congress, led by its political leader, Kamla Persad-Bissessar, to lead this country for the next 5 years. This will be the Prime Minister-elect's second term in office.
Thank you for showing up. Thank you for staying on the course and believing in our great party. Thank you, TNT. I say thank you for your support during this campaign. Thank you for your confidence for a better TNT. And for letting the world know that we, the people, have the real power in Trinidad and Tobago.
The results are coming in now, and from what we have coming into Balizé House, it is clear at this time that we have lost the election.
Polls closed at 6 p.m. yesterday, but it took the People's National Movement just 4 hours to concede the election with what Dr. Keith Rowley called a surprising defeat.
We went out there and competed for the position, and the population clearly, from Tobago to Point Fortin, the population has chosen the package of promises made by our political opponents.
As implied from the previous videos, the UNC, or the United National Congress, they won the general election by a margin of 26 to 13, with 2 seats in Tobago going to the Tobago's People's Party, or the TPP. The TPP on the graph here being represented in blue, the UNC being represented in yellow, and the PNM being represented in red. The PNM, the incumbent party, they managed to win 13 seats in the general election. The UNC managed to secure this victory by winning most of the marginal seats in the general election. However, they were in for an added surprise by winning both Point Fortin and Labre. These constituencies are usually regarded as PNM strongholds. So now, with this change in the governing political party, comes a change in administration. The outgoing Minister of Health, Mr. Terence Singh, is being replaced by Dr. Lackram Bodoe.
I, Lackram Bodoe, solemnly swear that I will bear true faith and allegiance to Trinidad and Tobago, will uphold the Constitution and the law, and that I will conscientiously, impartially, and to the best of my ability, discharge my duties as minister, and do right to all manner of people without fear or favor, affection, or ill will.
While he was in opposition, Dr. Lackram Bodoe served as the shadow Minister of Health, consistently challenging Mr. Singh's policies and actions as the health minister.
I was taken aback a little bit in shock in terms of his contribution, but to say that there are 2 aspects to this, to the health sector. And I want to say at the very outset, both as a medical doctor and as a member of parliament, that I do agree that the approach of health and wellness is important for our country. We on this side agree with the approach of primary health care, and we understand that there are many of these policies that will benefit Trinidad and Tobago, will benefit the health of our people. We know a healthy nation is a productive nation, And, we would be willing to, to support many of these measures, many of which were already started during our time in government between 2010 to 2015, and I'll come back to talk a bit more about that. But also, Mr. Deputy Speaker, I want to make it very clear at the beginning that, whilst all of these measures are important, and while primary care is important, at the same time, it's very important to recognize that while we are taking a preventative approach, and all of these measures that are outlined, at the same time, there remains the issue of secondary care, the issue of treating with the problems that we see, and I welcome you, Madam Speaker, the issue of treating with the problems that we currently face and that citizens of Trinidad and Tobago currently face in the health sector.
Now, during the campaign, Dr. Bodoe made several promises regarding what healthcare and health would look like under the new UNC administration.
I am here tonight to tell you that when the UNC wins, healthcare will win. When the UNC wins, patients will win. When the UNC wins, doctors, nurses, and all other healthcare workers will win. Because a UNC-led government will work to ensure that all citizens receive proper health care. Our focus will be patient-centered and resource-driven. We will put patients first. We will deliver your services in a timely and efficient manner. No longer will the elderly go blind while waiting for their cataract surgery. No longer will heart patients die waiting for their angiograms and their stents or their bypass surgery. No longer will you have to wait years to get your CT and MRI scans. No longer will you be told that this medication and that medication is not available for you. No longer will you be waiting years for your clinic appointments and elective surgeries. Ladies and gentlemen, brothers and sisters, I have here in my hand a document. This document is the UNC Manifesto on Healthcare Reform. This document is available on the UNC Facebook page, and several items have been published in the newspapers already. This is a document that was formulated after consultation with several stakeholders and designed with you, the people, in mind. This document has over 50 policies, plans, and programs that will ensure that your incoming UNC government will not only fix the problems I've outlined above, but will do much more for you in the health sector. We will immediately treat the backlog of patients awaiting critical diagnostic tests and surgeries, including cataract and joint replacement surgery. We will complete the construction, equipping, and operationalization of the cardiac catheterization laboratories at all of our major hospitals. Under a UNC government, you would no longer suffer from the shortage of medication that you now experience both as inpatients and outpatients. We will review and update the CDAP program to include newer and more effective drugs, especially for those persons with diabetes and hypertension. We will make every effort to ensure that cancer patients receive their treatment in a timely manner, be it the drugs or radiation treatment. Ladies and gentlemen, this manifesto gives a commitment that the UNC government will fix the supply chain issue to prevent, you're always hearing about the shortage of drugs and equipment and supplies. We give the commitment that we will fix that. This is what hinders the work of our hardworking doctors and nurses. We will do an audit of all the faulty equipment to repair the broken equipment and to repair those that are feasible and, of course, to replace those that need to be replaced. We have to ensure, my brothers and sisters, ladies and gentlemen, that when you go to the hospitals, that the doctors and nurses are fully equipped and prepared and have all the resources to be able to treat with you and to treat with your problems in a timely manner. We will establish guaranteed maximum waiting times for clinic appointments, diagnostic tests, and surgical procedures. So you will be given the guarantee, brothers and sisters, ladies and gentlemen, that when you visit a health facility, that you will be given a time, maximum time that you'll have to wait for any of these investigations. we commit to doing a full review of the management of COVID-19 pandemic in Trinidad and Tobago, and we will create an emergency response plan to cover all possible medical crises ranging from natural hazards and oil spills to infectious diseases. Her number one item on the health manifesto is to deal with children, and it is this. It is a commitment to review the Children's Life Fund legislation so that many more of our children with urgent surgical and other medical requirements will be able to access this facility. Kamla Prasad Bisesa will ensure that the elderly and school children receive compassionate and timely care. We'll once again open your health centers for extended hours and on the weekends for your convenience. We will engage the over 500 unemployed doctors to reach out to the elderly and school children in a real and meaningful way in their homes and in the schools.
Now you might be wondering, why am I paying attention to all of this? The reason why I'm paying attention to all of this is based on what I had said earlier on in this series. Who you vote for as your elected government representatives have a direct impact on your health, your family's health, your children's health, the health of the community, and the health of the entire nation. Also, this new administration had made promises during the campaign that reflect a particular philosophy regarding health and healthcare. And it's important to know that philosophy. The philosophy that guides this new administration regarding health and healthcare for the population will determine what its policies and actions are. And that will have a direct impact on the health and the well-being of the nation's population. Based on Dr. Bodoe's speeches, the UNC administration views our healthcare system as it is now as being very under-resourced. It seems that their focus is on increasing the availability of medications, medical equipment, and having enough trained personnel so that they can bring the healthcare services closer to the patient, and it will be more efficient for the nation's population. And hardly anyone can find too much fault with that view of the healthcare system. There are gaps in healthcare delivery, there are gaps in infrastructure which need to be improved upon, and I am very glad that this administration is taking the bull by the horns in improving that aspect of healthcare. However, based on looking at the UNC Health Manifesto, there is a very glaring omission in the UNC philosophy regarding health and healthcare, and I will show you what I mean by that. Now here is point 25 from the UNC Health Manifesto. This point deals with training primary care doctors, and the reason why they want to increase the training of primary care doctors is that increasing the number of primary care doctors will decrease non-communicable diseases such as heart disease, hypertension, diabetes, chronic kidney disease, and obesity. And that right there is the very glaring omission in the UNC philosophy regarding health and healthcare. That is because increasing the number of doctors in the healthcare system, whether public or private, will not decrease the rates of chronic disease in the population. Because if that were the case, the trend of the number of physicians being employed by either the public or private healthcare system in Trinidad and Tobago have increased from the 1960s till now. But do you know what else has increased from the 1960s until now? Chronic disease.
It is perhaps useful to bring to highlight diabetes and the status of diabetes in the country and the magnitude of the problem, because it's a huge problem in Trinidad and Tobago. The prevalence today is about 22% of the population in the country. 90% occurring in people having type 2 diabetes, and 20 to 22% would give us about over 200,000 people. So it's a large number of folks in our country that have this condition. Now, you may very well wonder, was it this way all along over the years? In the 60s, the prevalence of diabetes in this country was 3.4%. It's a vast difference, it's almost 6 times less. And when we travel up to the 80s, 20 years later, the prevalence was 10%. And today, 40 years later, it's 22%. So that's the prevalence of the disease. What about mortality of the disease? A little bit of history too. In the 60s, it was the 7th leading cause of death. So diabetes was pretty rare in the 60s. You know, growing up then, you never heard about diabetes. You probably heard about every other thing else, strokes and so on. And you wouldn't hear about diabetes. Communicable diseases like COVID and all the other stuff, measles, etc., malaria, they were much more common than these chronic diseases. So it is the 7th leading cause of death. And today, diabetes is the 2nd leading cause of death. So you will see what the situation. So we have much more risk with COVID being multiplied, simply having COVID. And as the population ages and you grow older, the presence of chronic diseases, and we're speaking about diabetes today. So diabetes, 2nd leading cause of death, accounting for 17% of total all-cause mortality, all causes.
Now, that was for diabetes. But let's examine the state or the rate of hypertension, cancer, and obesity in Trinidad and Tobago up to this present point. Now, these slides which I'm going to show you here, these slides comprise of data from both the 2011 and the 2024 STEP survey. Now, the STEP survey is a survey which is done in Trinidad and Tobago, in which they take a sample from the population and they get certain information and they do certain measurements on that sample population, and they use that to determine the level of risk factors in the population so that they are aware of what is the level of health or ill health in the population. And one of the risk factors that they look at is overweight, being overweight or obesity, the level of being overweight or obese in the population. In 2011, the mean BMI of the population was 26.5, which is classified as overweight. However, in 2024, the BMI or the mean BMI of the population increased from 26.5 to 27.8. So what that means is that we are getting heavier and most likely we are getting larger. So in other words, we are becoming more overweight and we are on our way to becoming pretty much obese in the population. The amount of people in the population who would be determined to be either overweight or obese, which is a BMI of more than 25, the percentage was 55% in 2011. That percentage increased to 61.2 in 2024. And the percentage of the population which were classified as obese, which, and now I don't have it on the slide here, but obese, if your BMI is more than 30, you are classified as obese. The people whose BMI was more than 30 in 2011 was 25.7%. That percentage increased to 31.6% in 2024. So overall, all over the board, we are getting larger and we are getting heavier, which doesn't augur well for the health now and in the future. Another risk factor which the STEP survey looked at was hypertension. Now, It is well known that heart disease is the #1 killer in Trinidad and Tobago. And hypertension is a very important risk factor regarding the morbidity and mortality due to cardiovascular disease. This comprises of heart disease and strokes and so on. Also, hypertension is a very important risk factor regarding chronic kidney disease, and that has been on the increase in the population as well. In 2011, the percentage of the population who had a blood pressure either at 140/90 or higher was 20.8. In 2024, that increased to 23.7. The percentage of the population whose blood pressure was over 160/100, so we get in the region of even more severe hypertension. That percentage was 6.4 in 2011. In 2024, that increased to 8.3%. The percentage of the population who had a blood pressure of 140/90 or were on medication for high blood pressure was 26.3%. In 2024, that increased to 29%. In 2011, the percentage of the population who had a blood pressure of 160/100 or were on medication for high blood pressure was 12.9%. In 2024, that increased to 16.9%. So pretty much you can see all across the board there has been an increase in the prevalence of hypertension at every, you could say, level of hypertension that there is, which doesn't augur well for the health of the population later on. Now, cancer has been a growing problem in Trinidad and Tobago, and based on recent data from 2003 to now, the trend of cancer in terms of prevalence has been that cancer has been on the increase from 2003 to 2019-2020. The incidence has increased and the mortality due to cancer has increased. Now, one may be asking, why do I have pictures of corned beef and sausages to the left-hand side of cancer? Now, I will get into this in another video. I won't take too much time on this, but one thing that you need to note is that the World Health Organization has classified processed meat under which these three fall under. Processed meat is a definite carcinogen. It is a group 1 carcinogen. In other words, there is evidence that processed meat causes cancer. So you may want to take a note of that. Specifically, colorectal cancer. And when you look at the prevalence of colorectal cancer in both women, as you can see here on the slide, 2,217 cases in women, and in men, 2,583 cases. You can see that the highest common cancer in both men and women is colorectal cancer. So I believe that that is something that everyone in Trinidad and Tobago should take note of. Now, this data, along with what I had shown earlier, this should tell us something, and that something is this. Yes, we need doctors. Yes, we need proper working hospitals. And yes, we need working medical equipment, materials, devices, and so on. But what may be the more effective or cost-effective approach when it comes to the NCD epidemic is to keep people or minimize the amount of people who end up in the public healthcare system with these conditions, and keeping people out of the public healthcare system and out of the medical institutions. It is not a matter of just knowing your numbers. It is not a matter of having more access to medication. The real leverage point in keeping more and more people out of the healthcare system being affected by these conditions is by the food that we eat, the very food that we put into our mouths each and every day. at least 2 or 3 times a day, we are either feeding chronic disease or fighting chronic disease based on the very stuff that is on our plates. And to me, this is where the UNC Manifesto starts to go off track. It talks grand talk about improving the healthcare infrastructure, medical personnel, medical equipment, healthcare delivery, times and efficiency and so on. But what it speaks very little on how we actually going to improve the health of the population so that less and less people are needing the public healthcare system to treat conditions such as hypertension, heart disease, diabetes, kidney disease, cancer, and so on. Now, to be fair, there is one item in this manifesto that shows some promise in this area of improving the health of the population. Now, according to the UNC, for childhood obesity, legislation for front-of-package warning labeling to be implemented on retail food products will warn consumers of high sugar, high sodium, and high fat items. This will intensify the existing awareness programs for combating childhood obesity and expand their reach. Now, I think this is a great first step in improving the food environment of the population. As a matter of fact, this is pretty similar to what Finland did in the 1970s, 1980s, and so on. Because what that did for Finland was that it made people aware of the amount of sodium that they were consuming in their processed food. And that drove legislation and that drove a whole lot of measures to reduce the salt consumption of Finland and in turn reduce the blood pressure of the population and reduce the mortality due to stroke and ischemic heart disease. So if the new administration can get this done, this, I wouldn't say work wonders, but it will be a very important first step. Now, the main question is, given that it has been promised in the manifesto, will the new administration follow through on it? Or will it be just a matter of, as some people say, all talk and no action? Now, countries like Chile, Mexico, Peru, and Uruguay have already introduced these front-of-package warning labels. And these labels are already having an impact in those countries. Now, my apologies for the small print. It might be kind of hard for you to see on the screen. But what this clip here shows is that the effect of the front-of-package warning labels in Chile, it has shown a decrease in the purchase or the volume of sugar-sweetened beverages purchase. It has decreased by over 23%. In Mexico, it has been projected that the front-of-package warning labels will reduce obesity by almost 15% after 5 years of implementation, and it is projected to save Mexico almost $2 billion US in medical costs. So therefore, if we can get anywhere close to that in Trinidad and Tobago, where we spend over $7 billion, TT is allocated to the health sector. If we can reduce those costs in the health sector, we can allocate some of those funds to other areas which have need of it, like, I believe, agriculture. But I'm not the administration. Now, I hope what that data shows is this. Front-of-package warning labels is a powerful tool to help individuals and families make healthier choices at the point of purchase. And in turn, what this does, it indirectly puts pressure on companies to reformulate their products so that their products are healthier. Because I don't think any manufacturer or any distributor want to have their product being slapped with a warning label. However, there is another twist to the tail of this front-of-package warning label. In 2024, CARICOM member states voted on the implementation of this front of package warning label in the Caribbean nations.
So this is our second time around the block. We had a vote in 2021 where 6 of 15 member states supported the octagonal warning label. Antigua and Barbuda, Barbados, the Bahamas, Dominica, St. Lucia, and Suriname. 3 opposed, Grenada, Guyana, and Jamaica. And the remaining 6 countries of the 15 CARICOM member states abstained. Abstentions arise out of a variety of reasons. When there's lack of consensus, or the member state does not feel that they've had an opportunity to have a truly consultative process. Abstentions do not count in the denominator. So in 2021, 6 of 9, or 66%, was insufficient to meet the 75% threshold, which is needed to advance the final draft to the next stage, where it goes back to cross-queue, then it goes off to COTED, and then you have a regional standard. So the standard was then relegated back to a draft standard and sent out yet again for further regional consultations, which took place over 2022 and 2023. Ultimately, in March this year, 75% of CARICOM Regional Technical Subcommittee, there are 12 countries which are tasked with the national consultation. Greater than 75% of those countries accepted the draft standard, which contained the OWL, or octagonal warning label, which triggered elevation yet again to the final draft standard and advancing to the regional vote, which is currently underway. And so here we are now, 2 weeks out from the October 14th deadline. So member states must submit their votes by October 14th to cross-queue. So the big question is, how will member states vote this time around?
I have written a letter to the Healthy Caribbean Coalition inquiring about the status of that vote and who voted for, who voted against, and who abstained. I believe this will be very important information for the new administration to see what are the hurdles that they need to overcome in getting this promise to fruition. So therefore, in my opinion, front of package warning labels are a great asset in improving the food environment of a population and nation, and in turn improving the health of the people in that population. However, it is not a silver bullet. There are other actions that this government needs to take and put into policy and maybe even law for the health of the population to improve. These actions include regulation of marketing to unhealthy products, especially children, reformulation of food products so that they are more health promoting for the population, and making healthy food more affordable and more accessible for the population, even the ones who are on the lower socio-economic end of the scale. Now, the affordability and availability of healthy food, especially to people who may not have as much as others, is an especially salient point, because guess who is the group of people who NCD affects the most? It's the people who don't have as much as others. Here is Stephen Rees of Breaking Dawn, the morning show on Synergy TV, making that same exact point when responding to comments made by the former Minister of Health regarding the addiction of the population to fast food and sugar-sweetened beverages.
How do you counteract that and lead people into a healthy lifestyle? What have I been saying for years? For those who watch the program, you all know what I've been saying for years, because I've been saying it for years. Why doesn't the government take the initiative and subsidize what you classify as healthy foods? Subsidize the vegetables, subsidize the fruits, make it more affordable, make what you're saying is a healthier choice more affordable for the average citizen. Because the fact and the reality is, the healthier stuff is more expensive. People can't afford it, so they will buy what their pocket could manage. Simple. Put a proposal before the cabinet and say, listen, we want people to make healthier choices in life. Let us make these items more affordable. A rough skin lemon is how much right now? It has sometime you walk in the grocery, if you go buy certain groceries, you see a rough skin lemon fall kind of $10 and $12. That is madness. Who policing that? Some of these prices in the grocery as well.
Now, normally I don't agree with Stefan on quite a number of things, but on this point, I 95% agree with him. Now, why 95% you say? I'm a bit skeptical about the subsidy part. However, I 100% agree with the premise of the statement that he made. If the foods that the health ministry, the doctors and the medical professionals regard as healthy, if the common man on the ground cannot afford to buy these foods, people will buy the foods that are more accessible and are more affordable for them to survive day by day, hour by hour, minute by minute. Here is one of Stefan's callers on the show, making that exact same point, making the link between poverty, our inability to afford healthy food, and chronic disease.
These people don't realize poverty breeds unhealthy lifestyle.
Correct.
About, let me say 60 or 75% of this population doesn't take home an income more than about $6,000 or $7,000
Yeah.
in a household. Let me say 4. Anybody without an income that crosses $10,000 to $12,000 cannot go into a grocery and pick up anything that is contributing to the healthy lifestyle or healthy living. Long time I used to hate salad when my mother and I make it and give me, because that greens and lettuce and all kind of thing.
Yeah.
Walking in any supermarket or places where they sell them pre-packed salad and thing, and tell me one little pack isn't about $60 or $70. How much people could maintain that lifestyle? A pound of broccoli is $30. And everything that is healthy that you talking about, after you make a grocery list and bring that into your home, in your kitchen, you don't cross about $4,000. The majority of this population isn't thriving enough. They are surviving.
Surviving, yeah.
Get up in the morning and try to survive. Yeah. And the cheapest thing that they have to put food in their belly and to let them complete a day is doubles and whatever you have outside there that you could spend a little $30, $40 and eat and feed your family. So this man talking one pack of donuts, and that just goes to show how detached these people is from reality that is taking place in this country. They have created hunger and poverty in this country, and now coming and telling the hungry, starving people, here what? Don't eat the food that you're living off.
Let's just put it this way. When we have an environment where a 2-liter bottle of black sweet drink costs less than a regular pineapple at Namdevco or a 15-pound watermelon, I think we see where the problem lies regarding costing of healthy food versus unhealthy food. And the high cost of food is something that the political leaders in society are very aware of.
15 to 1, don't forget that. 15 to 1. Your salary that is $3,000 will now be worth in real value $1,500. I go to the grocery, I still do my own groceries. This weekend I went to the grocery and I see how much more expensive it has become. So now let us take our $500 that now we get in $500 worth. Understand that same $500 because they can't give us more money. That same $500 could now only buy $200 worth of goods.
What have they done in their lives to prove that they are indeed, as they say, responsible? Are they in touch with the ground? Are they in touch with real people? I heard the new Prime Minister talking about he went in the supermarket. Man, where you living for the last 10 years? He now gone in supermarket and find out how high the prices are. But then who was there for 10 years to have all the food prices sky high? He now discovered have something called grocery and supermarket. Are they in touch with you? Do they understand what you face every single day in this country?
We will bring down the cost of living. Do you know just today how many messages and phone calls I got with people asking for food? They're not asking for money. They're not even asking for a house. They're asking for food. They cannot feed themselves. They cannot feed their children. A basic necessity of life. People in this country in 2025 do not have. And they want you to vote for them. We will remove VAT from essential food items and crack down on this price gouging. We will back our farmers with incentives and guaranteed prices so we grow more, import less, and eat cheaper.
Therefore, for this new administration to improve the population's health and therefore reduce the amount and the number of people entering medical institutions with chronic disease, causing a burden on the healthcare sector and causing a burden on the population. This new administration really needs to look at the affordability and availability of healthy food to every single class of society and introduce policies to support such. If they can do that, that will go a long way in reducing the cost of healthcare and improving the population's health so that the population can become more productive and we can even become a happier society. That's my opinion. But I believe when people are healthy, they tend to have more zest for life. That's just my personal take on it. What do you think? So therefore, Trinidad and Tobago, it's up to us to hold this new administration accountable. They have made quite a bit of promises in their manifesto regarding healthcare and the availability of healthcare services. Hold them accountable to that. Don't get me wrong, but also hold them accountable regarding improving the state of health of the population and having the policies and legislation in place to support such. And a good place to start, as I mentioned in this video, is by doing two major things. Number one, have the front of package warning labels on the processed food that we interact with each and every day, because having that will let us know which foods are health promoting for us or which foods are not so health promoting for us. And number two, have policies and legislation in place to improve the accessibility and affordability of healthy food to the population. Because by doing this, we will improve the healthier options in the population, and therefore we can have a better chance of eating healthier food and reaping the benefits of such. Because it is my belief that real health doesn't start in the hospitals and clinics, but it starts in our kitchens and in our gardens and eventually on our plates. In the next video, I will look at a policy action of the previous administration, which was created in 2021, which, if one takes a deep dive into it, will serve as a cautionary tale for this administration. Because it is my belief that this policy action taken by the previous administration, although well-intentioned, may have poured proverbial gasoline on the chronic disease inferno raging in the population. If you want to know what it is, watch the next video to find out. Oh yeah, and don't forget to subscribe, because by subscribing, you will be the first to know when that video comes out. If you found this video helpful, don't forget to like and share to spread the message of improving your health by improving your food environment. If you made it this far, I thank you for watching, and I will see you soon.